Hello and welcome to the third of a series of 3 videos designed to work with North Queensland communities and organisations to help towards building healthy communities. This final video consolidates what we've talked about in the first 2 videos and also provides a walkthrough version of a tool that we developed in partnership with North Queensland Primary Health Network called From Planning to Action: What can local government do in chronic disease prevention? We take you through a series of steps in this very short video around knowing your community, identifying and celebrating what you're already doing, how to prioritise the gaps and identify opportunities to build healthy communities. We also look at planning, including evidence-based and sustainable strategies. So not just what needs to be done in the plan, but what kind of strategies can you actually incorporate in that plan to build those healthy communities. We look at tips and tricks to help guide implementation, and finally look at some evaluation. So really this final video is your action steps, taking some of those early thought bubbles and thought processes and innovative ideas about what we might be able to do for healthy communities and really consolidating into how this might happen for your community. So like we have talked about in the previous 2 accompanying videos, chronic disease prevention is a huge challenge across our communities. So much so that not one agency or organisation can possibly tackle this problem alone. However, by taking a piece of the puzzle together, if we imagine this is all like a big jigsaw puzzle and we all need to take a piece and work collectively together to hold that puzzle together, we might be able to make a difference with locally driven, locally appropriate approaches for our Queensland. So as a reminder, those kind of risk factors that we're talking about when we're mentioning chronic disease are those things that relate to strategies and behavioural risk factors that we know contribute towards chronic diseases, such as some cancers, cardiovascular diseases, diabetes, those long-term diseases. Physical inactivity, unhealthy eating, overexposure to the sun's ultraviolet radiation, tobacco smoking, excessive alcohol, poor access to health information, poor health literacy, and also poor access to health services are all things that contribute towards our risk of chronic disease. So step 1, knowing your community. The Northern Queensland Primary Health Network Health Needs Assessment has a wealth of information about your local communities. You can access that here on the website or by searching for the needs assessment through your preferred platform. Identifying and celebrating what you're already doing is really important when you're starting to flesh out that action plan. So in the previous video, we looked at some templates and the kind of style that you might be able to use to develop that action plan. And we talked about who might lead that and how that might come together with different organisations or maybe a community consortium. But it's really important to remember that partnerships and collaborations are crucial for healthy communities, and community themselves are absolutely crucial players, to the point where it really should be driven and led by community for community with the support of organisations. These are the greatest ways to get change and achieve goals in community and help work towards that sustainability. But of course, building an action plan needs a platform to start on. And the best way to look at that is what you're already doing. There simply may also be some additional actions that could be implemented or some opportunities to measure and document local action to help build an understanding of what's already happening. So holding a workshop, a meeting, or doing a bit of a scoping exercise of what's already happening in your community to contribute towards building healthy communities is really important. You may find that already there's a lot of action happening, but it's just not all consolidated together. When it's not consolidated together, it means you can't celebrate the achievements. You also can't identify what's working well or what needs to be changed. And it's also much harder to dedicate resources, funding, and other priorities to collectively support that next level of action that needs to happen to support our communities locally. Here's a bit of a local action table and just some examples. And again, like in the previous video when we talked about the outline of the action plan, these can take many formats. It's really up to you what that might look like. But to be able to think about what is already happening in our community, it's a great idea to look at the risk factors separately. And the example we've got here on the screen is around physical activity. Again, this might be a great chance to just pause the video, maybe take a screenshot, a photo, or some notes about what you might like to consider when you're doing that scoping exercise to identify what's already happening in community around these behavioural risk factors. Looking at what are we doing, what policies and programs already support this, and what measures do we already have in place. And for issues like physical activity, it's important to look at a range of different actions. What's happening in infrastructure and the built environment, what's happening in participation programs, community awareness, strategies to improve access to physical activity. Healthy eating, another example. What are we doing? Policies and programs to support this, and what measures are already in place. The same thing for smoke-free spaces, should that be a priority? And again, for shade and sun protection, really important strategies for us in Queensland particularly. Celebration steps are really important, and this could be a great way to start that community engagement. Working with the community to say, hey, we're already doing these fantastic things, but what else would you like to see us do? What are the needs in local community and who'd like to be involved? It's great to start from a celebration platform to start with. Local communication channels are crucial. Spread awareness through social media, community newsletters, events, whether it's the sale yards, the sporting events, a large workplace gathering, the local show. Maybe it's a regular event that happens weekly. Maybe there's service club meetings or a combination of different activities that happen during the week. Local community service groups are also really great ways of communicating with community. Promote using newsletters from those local groups and get the message into their newsletters and into the way they normally communicate with community. And holding public events at local facilities can be a great way to engage community. Tell everyone what's already happening and then seek their input. Those celebration and awareness steps provide a great opportunity for community engagement and feedback. Sometimes if you start with a blank slate and invite people along to have a say about what needs to be done in community, but with no thought bubbles or way to simulate the action that might be happening, it's a really hard way to get the community warmed up to get that engagement. So by starting with celebrating what's already happening and talking about what's working well and not so well will often be a great starter for that engagement and encourage more engagement and more feedback. Step 3 is prioritising the gaps and identifying opportunities. So using the information that you've already gathered then by looking at what's already happening, identify some of the needs and gaps that you could address. Encourage community ownership and engage with the community in prioritising such issues. It's very important that the community help to prioritise the issues, and it's not just the organisations that do that. Doing that in collaboration is really important. But for example, if a group of health organisations were to prioritise the different health issues, it may look very different to actually what community know and live and identify as what those issues are. So it's important to get everyone involved. Some councils have community committees established, and some have links with key community-based organisations. The use of social media or online surveys could be another communication option to looking at how you can prioritise those gaps and identify those opportunities. Planning what you're going to do on the ground now to actually tease out those strategies and say, what are we going to do and how are we going to do it? Planning tools vary, and we talked about these briefly in the second video. And there may be specific tools that you have available as part of your council or part of your organisation. And these usually include those basic templates of a goal, objectives, strategies, a timeline, and some evaluation. Accessing the evidence is really important. Looking around to identify what's working in other communities and know that you can adapt that locally is a really great way of starting to develop your strategies. How can this work? Well, in the document that we talked about, and you'll have access to this through the North Queensland Primary Health Network, we do actually have a number of resources and links to supporting research on these following topics. Research to support the need for chronic disease prevention. And then we've also provided a series of links that help you engage with action that's already happening or tools and resources that are freely available to Queensland organisations to help address these particular issues. So please don't feel it's up to your organisations to develop these strategies alone. There's a lot of help out there. And engaging with key organisations across our great state that already work in this area are really important. In the previous video, we mentioned organisations such as Queensland Walks, the Local Government Association, the Heart Foundation, Cancer Council Queensland, the different local government departments, 10,000 Steps. There's all sorts of different organisations across the state who are working to roll out programs and services who you can engage with to then help develop those local strategies. And in the guide that we've developed that's available to you, there are links to physical activity and healthy eating strategies, shade and skin cancer prevention programs, tools, resources, and strategies, and the same for tobacco control and smoke-free spaces. There's been a lot of work in Australia over the past years to collate toolkits and resources to guide local government work. So don't again feel like you're starting from scratch. There are plenty of resources that you can use to kickstart your work, and so that your focus can be on how do we get this happening in our local community, and how do we do it in a locally relevant and locally driven way. And some of these toolkits are on the screen here. Again, it might be a great chance now to pause the video and either screenshot or take some time to look through these links. The same again for shade and sun protection tools. So don't feel that you have to start from scratch making up what has to happen here. There are a range of different toolkits, resources that can help you step by step if, for example, increasing shade was one of the priorities in your local Healthy Communities Action Plan. Now, here's another template that you might be able to use then to make that happen. We simply talk about basic headings like a project title, a goal, objective, strategies, what are the resources going to be, what's the timeline, and what's the evaluation. Now, these kind of templates can also be really important to complement that overarching Healthy Communities plan that you might have. So that bigger Healthy Communities plan might outline what you'd like to achieve as part of the Healthy Communities vision, who's going to be involved, and what type of strategies might happen. But then to actually break that apart into achievable and actionable steps, project plans like this can be really useful. They allow that short-term planning to happen, and they also allow that incremental on-the-ground success to happen in terms of really tangible local examples that can also help build momentum, build extra funding, and build that local engagement. Some tips and tricks now for implementing. Ensure the strategies and planning is realistic. It's got to be locally relevant. Identify the resources. Who is actually doing the work, and where does it fit in a weekly capacity? This is really important to make sure that it's not expected to be too much of a burden on certain organisations or certain people. How is the work being monitored and reported on? So how do we know what's working? Is it a regular agenda item back to the steering committee or the collaboration? Is there a group that's responsible for reporting in? And how is that being documented? The documentation is really important, or else these things happen and there's no way of knowing what's working and not working. And there's also then no way of maybe trying to scale up or increase the impact of the work that's happening if the incremental and pilot work isn't well evaluated. you've got no evidence then to say why it should be scaled up or why it should be maybe made more broad across the whole region. Is there a separate working group that's needed to oversee the project, and who might be involved in this? Is there public feedback on the progress, and who's going to engage with the public and then monitor and collect this feedback? And really importantly, how will the milestones be celebrated? Not just reported, but how will they be celebrated? Sustainability is important. Many of us have been around for such a long time that we've seen these things come and they go, and they start and they stop, or there's money and then it runs out. Thinking about sustainability from the start of healthy communities planning will help to ensure its success. It's important to think about how chronic disease prevention approaches can be longer term and become part of the way the community functions. So it's not these things that add on and then they drop off later on. Throughout the evaluation, you can think about how the approaches could be sustained and integrated into the way the council and community works. For example, strategies around events such as shade and healthy food could become part of relevant policies, or improving access to health and other services could even be relevant in transport planning. It's important to think really broadly here about how these things can be sustained. Evaluation, it's such an essential part of programs, but it doesn't mean that it needs to be an expensive or additional process that happens. It's simply just about progressively collecting information and documenting what's working, what's not working, where do we need feedback, where do we need to collate some numbers or some feedback to know that what we're doing is meeting some needs here, working well there, needs to be improved here, we need to add some resources here. So it doesn't need to be an expensive thing that happens at the end. It should just be part of the way that the program is rolled out. We can be fancy and talk about 3 different ways, and we've done that here just to be able to tease it out. But process evaluation is like the first one that happens as the program's rolling out. Is the program reaching the priority populations and communities? Are the materials and resources well received? Are the activities being implemented as planned, or if not, what can be changed? And are intended communities and participants satisfied with the work that's happening? It's important that the community is very engaged. Impact evaluation is once the program's been running for a little while. Are those objectives being met? What strategies need to change to be nimble with the community needs and the local context? The strategies need to be flexible and move with the way communities working. If something's happened locally, the strategies might also need to change to also acknowledge that. And what behaviour or environmental factors have changed as a result. Then longer term outcomes depend on the program. It can measure things like longer term participation, presence of facilities or programs that might have been developed, or it can look at changes in attitudes, behaviours, maybe improvements in local environments, whatever those longer term goals were. So this has been a very brief snapshot of how you might take some of those thoughts that we went through in the first 2 videos and actually start to develop them into the how. How is this going to work for our community? And how can we collectively work together in our community and across our region to work together to build healthy communities? Thanks so much for listening, and you can find more information on the North Queensland Primary Health Network website. Thanks again.